Well, I'm sure folks will keep joining us, but we're going to get started with our program today. Again, good afternoon and welcome to the Greater Miami Chamber of Commerce's Thursday Roundtable. I'm Alfred Sanchez. I'm President and CEO of the Chamber. Before we begin, as you see, I'm already dressed in holiday gear, and so let me wish everyone a happy and safe holiday season. It's been a very long and trying year, to say the least. Most of us have had to make incredible sacrifices, not seeing family, not gathering with our friends. But as our topic today will cover, the end of our trials is in sight. So a vaccine is going to be soon available. And I urge all of us just to tough it out just a little longer. It would be a shame for us to lose all the investment and progress that we've made in this marathon, to have all of the sacrifices evaporate and our loved ones perish when we're just steps away from the finish line. Hang tough, support each other, and I know we're going to cross this finish line together. And as our Mayor Daniela Levine Cava's COVID campaign slogan says, we can and we will. Happy holidays, everyone. So, okay. As I mentioned, today our topic covers the local phase 3 of COVID testing for the vaccine, what it means for all of us in South Florida. Our session has been organized by the Chamber's Healthcare Committee, led by Cliff Bauer and Brian Brown. You'll hear from them in a few. And it's brought to you by the generous sponsorship of AvMed, FHE Health, and UHealth. We have an impressive and distinguished panel with us today who are going to talk about such things as where we are with the virus today, the vaccine development process and approval, the importance of signing up for clinical trials, not just COVID, but all clinical trials, myth of the vaccine, what to expect in the coming months with flu and COVID, and the emergency use authorization that we're all waiting to hear for the vaccine. COVID has hit our health as well as our businesses. And the Chamber has been taking an active role in helping small businesses with the CARES Act applications, as well as now the forgiveness process. We set up a help desk call center that we call GMCC Cares. And I'm sure the staff will drop that link in the chat. I think it already has been dropped in there. We're there to help out our small businesses. The Chamber, we've also partnered with Career Source of South Florida to award grants to small businesses through the Layoff Aversion Fund. These are reimbursement grant dollars. It's not a loan, it's a grant dollars up to $10,000 for small businesses operating in at least 2 years here in Miami, 3 to 50 employees. And it's a reimbursement grant, so you have to have the receipts to back it up and other forms if you want more information. And not only of the layoff aversion, but there are so many other grant programs and assistance programs from different municipalities that are still open and still out there, and they will expire soon if we don't use them. So if you're a small business and needs help, go to GMCC Cares link site and look at all that's available out there. So before we turn it over to Cliff, let me go through some of the logistics. All are on mute. We have the chat box open, and that's for you all to network with each other and exchange ideas. If you have information you want to put in to share with others, drop it in there. Feel free. If you have a question for our panel, it's important that you put in the Q&A section, because those are the only questions that are going to be floated up to our wonderful host and moderator today, Nikki Mohan. So if you want to get your question asked, Q&A session. Look, the Chamber is privately funded. We don't get government money, and so the dues from our members and the sponsorships of our supporting companies are what makes our work possible. And I want to give them the opportunity to say a few remarks as our sponsors today. So first, we're going to hear from AvMed, and with us today is a great friend of ours, Ashley Allen. She's Senior Vice President and Chief Strategic Growth and Marketing Officer. Ashley, welcome and thanks. Go ahead. Ashley, are you with us?
Yes. Hello. Thank you, Alfred. It's a pleasure to be here. And it's hard for me to remember that less than a year ago, Most of us had not even heard of COVID-19, and I don't think any of us could imagine that this would become one of the most important topics of our time. COVID has reminded us of how important our health is and how fragile it can be. It's also reminding us of the amazing advancements in medicine that we've seen over the last 200 years. If you're in the medical profession, you may have heard the story of a beautiful milkmaid that inspired the very first vaccine. Apparently, the beautiful milkmaid had a flawless complexion, and she bragged that she'd never have smallpox because she had already had cowpox. And a 13-year-old boy who was likely smitten with her is said to have overheard the claim and wondered if such an immunity was possible. That little boy turned out to be Edward Jenner, who developed the world's first vaccine for smallpox in 1796. From the time of Jenner's discovery, it took nearly 2 centuries for the World Health Organization to finally announce in 1980 that the world was free of smallpox. While the story's origin is not possibly the true origin is probably not as much fun as the folktale, but still serves as a great reminder that with innovation and determination, a contagion like COVID-19 can be controlled and ultimately eradicated. Operation Warp Speed has been a monumental undertaking, and with many ingenious and determined scientists and doctors like Dr. Jenner, that'll go down in the record books as one of the biggest vaccination efforts in history. Health plans like AvMed will play an important role when the COVID-19 vaccine becomes available to the broader population. Since the start of the pandemic, we've provided zero-cost diagnostic testing, zero-cost treatment, zero-cost virtual visits, increased access to prescription medication, waived referral requirements, and expanded behavioral health access. For us, it's all about for us, it's about removing potential cost barriers for our members and increasing access to care, which is why we'll be adding zero-cost vaccination to our list of COVID-19 benefits and coverage. As one of Florida's oldest and largest not-for-profit health plans, we believe in transforming lives. By uniting around this sole purpose over our 50-year history, we've aimed to inspire Floridians to focus on celebrating the riches that matter most, health and happiness. I want to thank the Greater Miami Chamber of Commerce for hosting this extremely important event and for allowing AvMed to be part of it. We applaud the efforts of the Chamber for their strong sense of social responsibility and their commitment to engaging the local community. We hope everyone enjoys this webinar, and we look forward to our continued partnership with the Chamber.
Thank you, Ashley. Really appreciate your sponsorship and your leadership and partnership. I also want to give a shout out to Brian Brown, who's the head of group sales and retention for AvMed, who's on our healthcare committee as vice chair and serves on our board. And I want to thank Brian for your leadership and support. Next, let me bring up from FHE Health, Dr. Bo Nelson, Chief Clinical Officer of FHE Health. And Dr. Nelson, we really want to thank you for being here and supporting this.
Thank you, Alfred. We're so happy to be able to support innovative and thoughtful communications with our community during the time of COVID. More so than ever before, people are realizing, both with substance abuse and mental health issues, that often we need to reach out and have help. For more than 20 years, FHE Health has been a place for hope and healing when people need it most. Today, we offer mental health and substance abuse services using an integrated care model with a comprehensive approach to health and well-being. Our team of medical and psychiatric providers, nurses, clinicians, neuroscience specialists, and support staff provide the best care for our patients and for their families. As a nationally recognized provider in the behavioral health field, we work alongside businesses, unions, municipalities, and with individuals and families to provide effective and evidence-based treatment for substance abuse disorders and mental health conditions. Our specialty care encompasses innovative modes of treatment, such as a specialized program working with first responders, as well as innovative treatment using cutting-edge technology, such as our neuroscience treatments that are able to actually treat the brain and give people a chance for hope and for healing. We're so pleased to be a part of this today and look forward to the information shared. And thank you to the Chamber for the opportunity to be able to participate.
Thank you, Dr. Netherson, and Kathy Hurt, Community Impact Director, who's with us today as well, and FHE Health for the support and participation with the Chamber. We learned last week on our discussion of homelessness and how important mental health is, and you're serving a vital role. So thank you for that. And last but far from least is UHealth. We are so excited to hear from Dr. Carrasquillo and the tremendous work that is taking place right here in our backyard at UHealth. Let me say thank you to Myrna Vaca, who's such a dear friend of ours, such an incredible Chamber member, and she's the Director of Community Relations at UHealth. She serves on the executive committee of the Chamber and has offered so much of her time and so much of her leadership, and we thank her for that. And now it's my pleasure to introduce the chairman of the Chamber's Healthcare Committee, Cliff Bauer. Cliff has worked in healthcare management and administration for over 40 years in a variety of different settings. Since 2011, Cliff has worked at Miami Jewish Health, overseeing community programs, government relationships, and the expansion of PACE insurance for the elderly. He and I have come to know each other very well through the many different government affairs trips that we've taken to DC and to Tallahassee in support of Chamber businesses and keeping the economic health of Miami-Dade County. So we're very lucky to have his guidance and leadership, and I want to tell you what great thanks I have for him, and what a great pleasure it gives me to introduce you. Cliff, the floor is yours.
Thank you very much, Alfred. I want to add my holiday greetings to everyone. It's very appropriate today at a time where it's a season of hope. What we're talking about today gives us great hope that this pandemic has, at least we're beginning to see a light at the end of the tunnel. We've arranged for a great panel of presenters, and a great panel takes a great moderator. And to that end, we certainly have chosen the best, and we're pleased to have Nikki Mohan join us as the moderator of this group. For those of us who've lived in South Florida for a few years, she's a very familiar face and voice, given her role in local TV, where she was the former anchor of the Channel 10 ABC affiliate. She's also an award-winning journalist, and she has a great breadth of experience at more than 10 different TV stations in 5 different cities. Today, she serves as the CEO of her own consulting company, but more importantly, today she serves as a moderator to this panel discussion about the COVID virus vaccine. And to that, I turn it over without further ado to Nikki, and thanks to all for being a part of it.
Thank you so much, Cliff. I appreciate that warm introduction. Welcome, everyone, and thank you to for joining the Greater Miami Chamber's Healthcare Committee presentation. What an exciting day to be here. I woke up, I heard the news this morning, and I felt hope. I felt uplifted. And our goal for this panel is to provide a valuable exchange of information and insights. You can put in your input into the chat. We'll try to get to it. We have 3 great experts that we're going to have the privilege of learning the latest on the vaccine for COVID-19. To begin the conversation, we're going to hear from Dr. Olvin Carrasquillo of UHealth, the University of Miami Health System. Dr. Carrasquillo will provide an overview of the general state of COVID-19. Currently, Dr. Carrasquillo is the co-investigator for the Janssen COVID-19 vaccine trial and the lead investigator for the state's NIH-funded Community Engagement Alliance against COVID-19 Disparities. Dr. Carrasquillo is a professor of medicine and public health sciences at the University of Miami's Miller School of Medicine. He is a Puerto Rican-born physician who was raised in the Bronx. He obtained his MD from the New York University School of Medicine and completed his master's in public health from the Harvard School of Public Health. For the last 9 years, he has been the chief of the Division of General Internal Medicine. He oversees a clinical, teaching, and research enterprise of 44 full-time faculty, including 6 primary care practices and an additional ambulatory hospital-based clinic at the Jackson Health System. When did you find time to join us here today, Dr. Carrasquillo? And we're so happy you did.
Thank you. Pleasure to be here.
Take it away. What is the latest as we speak at this hour? Because we know this is changing and we're waiting for breaking news any minute now.
Thank you. Thank you. And again, I want to send a shout out and thank you for both the Chamber of Commerce and the sponsors, both AVMed and FHE Health. Thank you so much for doing this. And also shout to Alfred and Clark for doing this, and our wonderful moderator as well. Thank you so much. I think I'll start with what I want to conclude, because Alfred already hit on it, which is we're almost there, right? I mean, this has been such a hard year and we're almost there. We can see light at the end of the tunnel. And I think the overall message, while some of the numbers look gloomy, the overall message we want to convey is one of optimism, because we see the end game here, and that's always really positive. Whenever a doctor talks and he puts on a screen, everyone kind of glances away. Oh no, not another doctor with PowerPoints. We're just going to go through a very quick 10-minute overview of where we are with this. But then most of the meeting is going to be mostly about discussion and answering your questions, because that's what we're here for, especially on the vaccine issue, which I'm not going to talk a lot in the overview, because obviously we expect that some of the questions are going to be about that. So if I could go ahead and share my screen. And let me see if everyone sees it. And Neki, maybe you could tell me if it's showing.
Yes, we can see your screen.
Beautiful, thank you. And again, I'll try myself to keep a doctor on his PowerPoints during the 10 minutes. One is the data and the numbers when we are. It's always important to start that. And what we're seeing worldwide, 70 million cases across the world, and here in the United States, over 50 million cases. And the number of deaths, we're nearing the 300,000 in the United States, and in Florida, we'll exceed 20,000 deaths very shortly. So really, really devastating disease across the entire country. And clearly the United States has been very, very disproportionately affected by this virus. These are the trends. So these are the trends of where we are up in the world. The green one is the United States. Clearly, we've been the ones most impacted by this. This was India, this was Brazil, but clearly we do see a spike in a lot of other countries. But compared to every other country, we're just so much worse than every other country in the world right now. So really disproportionately affected us. This is where we are in the United States, the so-called 3 spikes. This was a spike in April that most affected the Northeast. This is where we were up in July. This is when Florida really got hammered. And then we have now what some people are calling the 3rd peak. I'm not sure if we ever went down low enough to say we got over a peak, but this is where we are now. This is Florida. Again, this is our peak in July, and now we're almost back up there again. We still don't know. Some people think that we've kind of hit the top of this. Other things that we're still going to go up a little bit more and then start coming down. But again, all those are just predictions. We don't exactly know. And these are the hot spots in the country. We do see Florida this time is a little bit better, but we do have obviously us down here in Miami-Dade that are being, again, disproportionately impacted. This is where we are, this is where we are in the state of Florida right now. And in our county, we've had almost 250,000 cases here and about almost 4,000 deaths in the county. And our positivity rate, which many people are following, is hovering. It was 10% a week ago. Now it's a little bit better. Again, anything above 5% is alarming. So the numbers are still, the positivity rate and the numbers are still quite concerning where we are right now in terms of the epidemic. So while there is light in the tunnel, certainly we can't by no means celebrate victory right now. And then this is the other point that I think Alfred and Neki hit on, which is the disparities. And as with many other chronic diseases, we see that it is the minority populations that are most affected by COVID and many other diseases, be it cancer, heart disease, that affect minorities much more, or HIV, for example. But these are hospitalizations, but they all show the same thing. And then this is here in Florida. These are age-adjusted rates of COVID. This is the Black population in Florida. These are the Latinos, and even, our indigenous population. And I promise you, I'm not going to talk a lot of science, but it's important to understand there's many coronaviruses. This was a novel new virus that got invented, but coronaviruses have been around for a long time. Cause a lot of other coronaviruses, cause colds, and they also thrive in animals as well. There's been other epidemics. Some of you may remember the SARS epidemic that happened almost 20 years ago, and then MERS that happened about almost 10 years ago as well. So we do see that there is other mortality, other conditions. And we've learned a lot in the last 6 months. Typically we used to say when I started talking about this, these were the typical symptoms: fever, cough, difficulty breathing, and that happened usually within 3 to 4 days after exposure. But since then, we've learned a lot about what other symptoms are: loss of smell, taste, gastrointestinal, diarrhea, weakness, malaise, muscle, body pain. And what I tell my patients right now is almost any symptom can now be attributed to COVID. So really very different from other traditional, what we used to think of flu or cold-like viruses. 80% of the people get mild disease or no symptoms at all. Severe disease happens at about 15%. And people that need to go to intensive care, it's about 5%. The case fatality rate when the virus started was about 5%, but here in the United States, we're seeing at 2%. Some hospitals here at UHealth, we're seeing an even lower case fatality rate than the 2% that's nationally reported. And we do know who are the vulnerable groups. We have a lot more data. The elderly, those living in a nursing home, severely obese, but a lot of other major medical conditions put you at risk for severe illness. Back in April, in terms of prevention treatment, we really focused on the public health approaches that are still critically important, and trying to quarantine people who had the disease and isolate those close contacts. And it was mostly about supportive care and oxygen treatment. Since then, we've learned a lot. We have much better data about things like masks definitely being effective that support these prevention interventions. We're much better at predicting who will get sick. We know what blood markers to follow, and we know a lot more about the biology of the disease. We also know what doesn't work. Hydroxychloroquine, we had a big study here, but turns out it doesn't really work. And we have a lot of promising things. We are really excited about remdesivir. The more recent data doesn't show that it's as effective as we thought, steroids. And most recently now we're giving monoclonal antibodies. And we continue to work on investigational treatments, but obviously the big preventive thing, and again, I haven't checked my phone in the last hour, so I don't know whether it actually got the emergency use authorization, but it's the vaccines. And then we're also learning about this post-COVID syndrome. People, as with many other bad flus, people sometimes can have persistent cough and respiratory symptoms for weeks to months. And we're seeing this a lot in COVID. Cardiac abnormalities after having COVID, also a big area that we're doing research on. The cognitive effects, the mental fog, and now we're hearing about other potential mental health issues and insomnia and the COVID syndrome. So all these are things that are evolving, but we need to pay attention to. However, the vaccines are coming out, but prevention is still the most important thing that we can do against the coronavirus. Face mask wearing, the data is absolute. We need to do this. It does protect us, but more importantly, protect others. Critically important, we all wear masks to protect others. I mean, we can't emphasize that. The science is absolutely in no debate here that masks work to protect others, and we absolutely must do it. And obviously knowing how to wear a mask and the proper ways. You don't wear a mask where your nose is still exposed is one example. Social distancing and keeping the distance is really important still. So that's really key. And then, personal protective measures like hand washing and using alcohol frequently. Those are still the main important messages in terms of prevention. And clearly, anyone who's sick needs to be quarantined. And if you've been in close contact, you need to be isolated until we find out your COVID status a few days later. I think the businesses have done a really good job at trying to figure out how to keep people as safe as possible. And, most of the ethical businesses have been doing this really well, promoting good hygiene, avoiding crowding, and things like that. And that's one important role for the chamber. And the vaccines, which we'll talk about, again, we have this, emergency use authorization, but I just want to tell people we're still doing a lot of research into the vaccine. Some are being studied. The Johnson & Johnson, the Janssen vaccine we're working on, we're completing that study sometime in the next 2 to 3 weeks. And we need a lot of companies to make vaccines because we need to vaccinate the world. The messenger RNA vaccines, which was a novel technology that, had been used in cancer in animals, but turns out to seem at least have really promising data in humans. So Pfizer will be the first one to hopefully get emergency approval today. Moderna will follow a week or so later. And then the vaccine we're testing right now, Janssen, will probably be submitted in January for emergency use. And there's many others as well. And this is the main challenge we face in public health, which is a lot of the lies and misinformation out there. All of you have crazy stories. I've heard everything from people swearing that masks don't work, that they drop your oxygen, which is absolutely not true, that you can inhale toxic chemical from masks. Absolutely not true. We've heard stuff that 5G towers somehow interact with the COVID virus. Everyone has a different lie about this, or that the COVID vaccines, even you get the vaccine, you will die, and we have to stop this, the government from doing this to us. So a lot of lies and misinformation, and that's the major public health threat we face right now. They call it an infodemic, and it's a lot of people using predominantly online social media, but many other attempts to disseminate wrong information. And unfortunately, what we saw was that sometimes it was our elected federal and government leaders who are themselves spreading a lot of lies and misinformation about this. And we've seen the percent of people that say they'll take the vaccine dropping precipitously in the last few months, a really worrisome trend. And it being politicized. And when people see something being made political for which there is absolutely great science and politicians arguing based on party affiliation, that scares everybody. So that's been a major challenge to us. And developing strategies, which I'm hoping this session will be part of, but how to battle misinformation. Most people are not evil players that want to spread misinformation. A few are, but most people just, it's a very scary situation, and the kind of misinformation that's being spread out there, and the need to look to authoritative sources. And that's where health committees for the Chamber of Commerce can play a key role in trying to battle the misinformation that's out there. It's really critically important. Unfortunately, this was the Department of Health website today from the Florida Department of Health, and you will see COVID being featured, very tiny print over at a corner, sorry. And I'm sorry for my slides keep jumping. The traditional leaders in this, like public health departments, because of political reasons, may not be able to play the leadership role they traditionally have played. And that's where many of others have to pick up that slack and kind of fill in that role, since this has been politicized so much, which is really disappointing. So how can we all be as helpful as, business professionals, Chamber of Commerce's? Clearly a leadership role in this, becoming the people that get informed on credible sources of information and avoid misinformation that, fosters fear and panic, and helping provide, correct information about all these, and how to, build these relationships and networks so that we're all doing the good work. And I think I went over by 30 seconds, but really it's a dialogue and discussion. Let me stop sharing my screen right now. But it's really the dialogue, the discussion, and taking all your great questions on this. So thank you very much for doing it, and we'll open it up. So Nikki?
Thank you, Dr. Carrasquillo, and already folks are weighing in with great questions for you, so get ready. But first, I'd like to turn our attention to the rest of our panel members. Please make sure you submit any questions for our esteemed panel in the Zoom chat function at the bottom of your screens. Dr. Victoria Behar Zussman, she's a professor of the School of Nursing and Health Studies at the University of Miami and the contact principal investigator for the Center for Latino Health Research Opportunities. Thank you for being on our panel this evening. Dr. Behar Zussman is a clinical psychologist with a research focus on interventions for families affected by mental health problems, substance abuse, HIV, and other chronic illnesses. She's also the principal investigator with another one of our panelists, Dr. Mario De La Rosa of the Center for Latino Health Research Opportunities. Claro focused on community-based research for development, testing, and dissemination of culturally tailored interventions to address the HIV/AIDS epidemic and substance abuse, violence, and mental health conditions among vulnerable Latino groups. Currently, Dr. Behar Zussman is a part of a team of investigators for the Community Engagement Alliance Against COVID-19 Disparities that aims to address misinformation around COVID-19 and also to engage minority populations in COVID-19 related research. Welcome, Dr. Behar Zussman. Now, let me introduce you to, yes, actually, thank you so much for joining us today.
It's a pleasure to be here. Thank you very much, Nikki.
I'm going so fast, so thank you. I want to get all these wonderful questions that are coming in. Let me now introduce our third panel member, Dr. Mario De La Rosa. Dr. De La Rosa is a professor of social work at the College of Public Health and Social Work at Florida International University. You also work at the founding and current director at the Center for Research on U.S. Latino HIV and AIDS and Drug Abuse, which is a multidisciplinary research, education, and community outreach center dedicated to eliminating health disparities that affect the Latinx population. He is a pioneering scientist in the areas of substance abuse, HIV/AIDS, and cross-cultural issues affecting the Latinx population. Welcome, Dr. De La Rosa. Thank you. Welcome to all the doctors for being here today. Let us begin our conversation. Our first question is for Dr. De La Rosa. Dr. De La Rosa, you are an expert in the vaccine distrust, fears, and misinformation in the Latino population. Can you discuss what strategies you have right now for community engagement around vaccines?
Well, thank you, and it's a pleasure for me to be here. I think that what we need to do is when we deal with the Latino population, we need to make sure that we think about Latinos as not a monolithic group. They're very different. There's different Hispanic subgroups, and therefore, we need to take into consideration the social context in which they live. Within these communities, that there are some vulnerable populations, that we need to make sure that the strategies that we develop to make sure that we deal with some of the fears and misinformation that's out there. We develop, strategies that are able to use the available social media channels that they have to be able to get this information to these individuals, to be able to call upon some of their community leaders that they trust for them to be able to sort of deliver this information and these messages. So I think it's very important that in order for us to be effective in addressing the whole issue of hesitancy of getting the Latino population vaccinated, that we take into consideration that that it's not just one size fits all, that there are many different strategies and there are many different subpopulations. For example, in Latino population, we have in Miami-Dade County, we have the migrant community in the south of Florida. They're very different than the urban low-income communities that surround the little Havana and little in Alapata area. And they do have different ways, different cultural values and attitudes that they sort of gravitate to, and they have certain places that they go to, certain community leaders that they believe in, radio stations, and so forth. So the bottom line is, what we need to do is we need to really make sure that we take into consideration those differences, and then use the channels that are available to be able to get to them, and use messages that really will work with those specific communities. So that's just the beginning. Obviously, there's many other things that need to be done.
Absolutely. My next question is for Dr. Behar Zussman. What are the root causes for disparities in minority communities, in the physical and behavioral health issues that have come up throughout this time?
Yeah, that's a great question. Thank you. There's a lot of root causes for these issues, and a lot of them have to do with sort of the life context that people live in and their work context. Many of us are fortunate to have the opportunity to work from home. Many people in the minority community do not have that benefit. They have no choice. They have public facing jobs, or they have what now we're, hopefully really appreciating as essential jobs. And so they're not able, they have more exposure than other people. They could have occupational exposure, for example. They could also have exposure in their housing situation, because either they live in a dense neighborhood, a dense housing situation, or even within their house, they may have multiple people in their homes of different generations, some of whom can stay at home, some of whom are not able to stay at home. There's also, they are more likely to have, because of socioeconomic issues, they may have to take public transportation. So again, exposure is one of the big driving factors here. We also have, as Dr. De La Rosa was saying, we have our cultures, and our cultures that are minority cultures, Latino culture, the African American culture, the Caribbean culture. We tend to really be connected with our extended family, and it's very, very challenging to do Zoom dinners, to do those kinds of interactions are just not within the sort of the habits or the culture of these families. And additionally, some people just don't have access to the sort of the internet, to the Wi-Fi kinds of resources that other people may have, either because they don't have the computers, they don't have the Wi-Fi, or they just don't have the habit of using, electronic banking, electronic grocery shopping, et cetera. So a lot of it is about exposure. Some of it also is about pre-existing health conditions that also predispose people not to getting the virus, but to having more severe disease.
And I'm going to open up this next question for the entire panel. And this is what, we talk about the diversity of South Florida. Let's talk about the diversity in these clinical trials and how crucial they are, especially as to how this all affects communities like ours.
Thank you. And I
Dr.
guess,
Carrasquillo?
yeah, I'll take the lead shot at that. We've seen a lot of these diseases that disproportionately affect minorities, like diabetes, heart disease, cancer, that minorities are actually underrepresented in the landmark studies that showed whether certain drugs or not work in these populations. And we see the same pattern in COVID, was we saw, one big trial I'm aware of, the Moderna trial, we saw that only about 10% of the population, let's say, was African-American. In the Janssen trial, we're getting some data that nationally, they're also representing minorities in that study. As Dr. Bahar Sussman said, minorities have different risk factors for these conditions. So it's important that we're adequately represented so that then we know the vaccine is safe and effective for everyone. So that's why it is important to have enough minorities represented in all research, because our living situations, the conditions we're under may be very different from other groups. And that's why it's important we participate in these studies.
And let me just add to that, to what Dr. Carrasquillo said, that I think historically, the research community, particularly with Blacks, there have been some history of mistrust because of certain clinical studies that have been conducted that negatively impacted some of those communities. So there's a level of mistrust to get involved in research. So I think we need to, as researchers, we need to be innovative in terms of how we go about recruiting and maintaining our participants in our studies. And that's a challenge. That's why we need to really be connected to the communities in which, we're doing the research, and that we'll make sure that we're not just our helicopter researchers, that we'll go into those communities, do the research and get out of there and, don't get back to those communities. So I think it's important. And that is something that we're doing. And that's something that, the history is beginning to be reestablished with, to have those communities, begin to trust researchers. So I think it's important that we acknowledge that, and we work to make sure that those fears and mistrust that our communities had are put aside.
And also,
I want to take Go ahead.
Go ahead.
Go
No,
ahead,
I was just gonna add that, we're doing a lot of listening. We need to go out, listen to our communities, understand who are the trusted sources of information for them, and then really working to make sure that those trusted sources of information have good quality factual information so that they can deliver really the best quality info out there, not misinformation.
Thank you so much. And now as we talk about, South Florida and these blended families, we have multi-generational families. A lot of people are asking about children. What do we know about the trials for vaccines done on children? We've talked about children being asymptomatic as we, get closer to a vaccine being available.
Thank you. And it's always, children is another group that's always underrepresented in a lot of research studies, unfortunately, for many reasons. And in the COVID vaccines, right now, most of the data we do have is on adults. Our study is right now on adults, but it's critically important that at some point, we do studies on the children to make sure we're seeing some differences in the elderly response to the vaccine, for example. It looks like, and we need to show with children. The big fear in children is, first of all, some children do get COVID and some get really, really ill from it. I think that was one of this information that kids cannot get COVID. And we also know that they're carriers. So they can carry the virus and spread it from other people. So, while many of them are asymptomatic, they can't spread it. So it's important that we do studies in kids as well to make sure the vaccines are safe and effective in children as well. And they will happen. They just haven't happened yet.
We have coming in on the group chat from one of our people that are tuned in. This is specifically about the trials. For those that are volunteers in the trials, when there is a vaccine available to them, will they be able to be unblinded in the study?
Yeah, I get that a lot from a lot of my participants now that it's come up with the eminent. So we don't unblind participants because we don't know if people have had COVID, if they had, an experimental vaccine, and then we have something that has emergency use authorization. We think that if they want to be vaccinated again, they can. We don't think there's any increased risk, but it's important they tell the vaccine sponsors that they're doing this and that they're getting the other vaccine so that we keep track of that because that's going to be critically important data. But certainly for the vaccine trials we're doing, we're not preventing anyone from signing up based on, well, I think in the future I may get one of these vaccines. You can still sign up for the trial. And when you become eligible, then you get them. And remember, the initial dose of the vaccines are not going to be for everybody. The first doses are going to those that are institutionalized and frontline healthcare workers. It may not be till the late spring or summer till we have vaccines for everybody in this country.
Yeah, and Vicky Lopez also sent in a question. She says, we've just learned that those with significant allergic reaction should not take the vaccine. They want to know about other conditions such as pregnancy, people undergoing fertility treatments. Do we know anything about that? About whether or not they should not or take the vaccine?
Yeah, once we look at the emergency use authorization, there are a couple of reports from England about allergic reaction to the Pfizer vaccine. I'd be really interested in really drilling down and doing it here and what the EAU guidelines are going to be about people with severe vaccines. Clearly, anyone that has mild allergies should get the vaccine because they may be at higher risk. So that's critically important. But a lot of this is still being waited to be sorted out. Right now, we're not including pregnant women in the vaccine trials. And if a woman's pregnant for now, I would probably say maybe a good idea to hold off for a little bit. But again, the first most vulnerable groups are going to be, like I said, the institutionalized and frontline healthcare workers. I think by the time the vaccine becomes more widely available, we have a lot more credible data on which to make a lot of these recommendations.
Thank you, Dr. Karasky. So much of what we learned in all of this and what we all can do is the way we behave. My next question for Dr. Behar-Zussman is how can businesses, because so many people on this call, the Chamber of Commerce, they have businesses, they own businesses. How can businesses continue to encourage the physical distance and the mask wearing? Because we're still, just because there's a vaccine out there, like Dr. Karasky just said, not everybody is going to get it right away. And this is still very much a real thing we're dealing with.
Yeah, great question. And I think, as Dr. Carrasquillo said, I think the businesses in Miami-Dade County have overall done a really great job of, making it very clear that to enter, you need to wear a mask. And so I think the first thing is to know the practices. And at this point, I think a lot of us are sort of, from everyday life, have become experts. We know what it takes. The distancing, I see businesses with the plexiglass shields to protect their workers and to protect their customers, right? So making sure that their workers, first of all, that they're modeling the correct behavior. I walked into a store yesterday, and the clerk was wearing a mask under his nose. And so I think the first thing is for the business people to really reinforce the correct behaviors among their own employees, and then to make it very, very clear what the rules are for people who enter their business. Now, you have to sort of judge who you're dealing with, because there are going to be people who are going to be absolutely adamant, and versus those people that you can just talk to and who will be receptive. And you have to sort of get a sense of how receptive is the person going to be. And if they're not going to be open, then it's just better not to engage and just ask them to exit. Whereas I think a lot of people, if you speak to them in a non-judgmental manner, if you speak to them calmly, if you remind them that this is about protecting all of us, and if you have masks handy, if you have disinfectant handy, to make it easier for people to follow the rules, I think that helps to really not be overly confrontational, because as we know, it's become, in some cases, it has become a very polarized situation, unfortunately.
Yeah, but so like you said, Dr. Bejar's estimate is that so many businesses have invested in making sure that everybody has what they need to stay safe. This question was sent to us. I'm going to put it to Dr. De La Rosa. How can businesses help people get vaccinated, and how can the Chamber of Commerce help people get vaccinated?
Well, I think the businesses are a very important aspect of the communities, and I think that they can be involved in providing the information that people need to have in order not to be afraid of getting vaccinated, to provide information that, basically says that the vaccines are safe, they are effective. So I think that having information that is in appropriate language of the individuals who live in those communities, that they have individuals that, in the small businesses there are providing with the employees are providing some information about the vaccine and what needs to be done, and be taught, providing information about some of the fears and some of the mistrust they have, and why they're not really true. So I think that they can be an integral part of really disseminating information in the communities in which they live, because they know those communities better. They know their clients. I mean, some of those businesses have been, particularly small businesses, have been in those communities for many years, and some of the owners are trusted. Some of the employees have been working in those in those businesses for many years, and some of the people that come in there know those individuals. So I think that, getting them the right messages out, I think is important to counter a lot of the fears and mistrusts and myths that they're being propagated out there in social media and many other channels.
Yeah. This question coming in into the chat, Dr. Carrasquillo, many of the vaccines say they're 94% effective, somewhere in that range. Does that mean, people want to know, does the other 6% get sick? What happens to the other 6%? And where do people go for the right information?
Yeah, I mean, that's, some of this data that we're looking at has been preliminarily released by the companies to the press. We do need to dig down a little bit closer at this data and look at some of those subgroup and critical questions. That was the primary outcome. But as one example from Moderna, we're hearing it's 100% effective against severe COVID, 95% effective against any type of COVID, whether it be asymptomatic or, or mild COVID or something like that. But we really need to look at the data. But at the end of the day, where do people get their trusted health information from? Obviously, their physicians, their doctors, their healthcare providers. Those are, going to be really important. Places like UHealth, we always put out credible health information. FIU, their doctors also, very leading authorities. You got to listen to the scientific experts, the healthcare providers, the people that are really working there. We try to work with the community partners and get this community information. What I'm begging people who are not to get information, it's not your cousin's, friend's, brother's Facebook posting. That is definitely not where you want to get and make critically important health decisions about. Listen to the people that you go to normally for your health information. You first certainly wouldn't go up and take some, medicine nobody's heard of because of a Facebook posting. And I would say with issues of COVID, it should be the same.
Good point. Dr. Behar-Zussman, we've talked, a lot of people are just worn out by this pandemic. We have this, it's probably going to be like a condition in one of the medical journals soon called pandemic weariness. But, but you said you've been really working within the community to help people deal with all the situations that are popping up at home, which in the fields that you work in, substance abuse and speaking to people. Talk about that.
Yeah. So every single family, obviously, everybody on this call, their family has been affected day to day. And it goes all the way from really severe mental kinds of stresses and strains that can lead to substance use, that can lead to intimate partner violence. And we do see those things rising. And it's partly because of the stress. It's also partly because people are isolated, and then the problems are more invisible and more likely to fester. And so those are the worst case scenarios that we're seeing, and people are not accessing as much mental health services. So I'm really happy to hear that there are mental health providers as part of this call. And then it goes all the way to sort of just everyday life and coping and dealing with things on a regular basis. We did a pretty extensive international survey, about 4,000 people early on in the pandemic. And we asked people, what are the kinds of things that you're arguing about more than before? What are the kinds of things that you're feeling togetherness more than before? And actually, on the balance of it, in this large sample of people, they were feeling more togetherness than they were. They did talk about increased conflict, but they also talked about increased togetherness, and that was even higher than the conflict. So people are spending more time together, more quality time together, eating together, solving problems together. And those were sources of togetherness. And I think that people should try to hang on to those as much as possible and let the positive feed, nourish them. The negative things, the kinds of things, the number one item that people were arguing about was home maintenance. Who does the housework? They were arguing about children's homework. And all of these things are adding strain. And people really have to, parents and have to take care of themselves first. It's like they tell you on the airplane, put the oxygen mask over your face before you put it on somebody else. You need to take care of yourself, and then also take care of your family, because this is a tough year for all of us. And we're seeing the light at the end of the tunnel, but we still have some months ahead of us before life gets back to normal.
Yeah, I think it's very, go ahead, Dr. De La Rosa.
Yeah, and to add to what Dr. Behar-Zussman said, this situations with mental health and substance abuse is even worse in some of the underserved communities because of the overcrowding that some of these individuals live in. Presenting problems with stress that as a result of living in such overcrowding conditions. Also, a lot of the children, that they go to schools, or they, doing school remotely, they don't have internet access. This creates stress for those families. So I think that the low-income communities and some of the minority communities are facing additional stress that I think we need to be aware of as we move into dealing with the pandemic long-term. And in terms of substance abuse, even though that we have a study that we've been conducting with Latino fathers and sons shows that the use of social drinking has decreased. Unfortunately, the use of problematic alcohol use has increased. As people are continue to be locked down and not going outside, those individuals that might be at risk for substance abuse are increasing their substance abuse, particularly alcohol use. So I think that this is something that we need to be aware of and think about as we move into the post COVID-19 pandemic. So I think it's important that we get this vaccines, people taking the vaccines, because it will begin to deal with allowing, some of the children to go back to school and deal with some of the issues overcrowding, and hopefully some of the issues that have had to deal with not being able to have access to internet so they can appropriately, receive the schooling that they need.
Yes, so important. We're getting so many questions into our chat. A lot of you are asking that for information. I can tell you that provide your email addresses to the organizers, and they wanted Dr. Carrasquillo's presentation, so you can keep that information going around. I've heard your businesses putting forward that information. It's so important to being part of getting all the right information out to the community. We have a question from a parent who's concerned about vaccinating their young children under 12 years old with a vaccine created for a novel virus at warp speed. A lot of people are concerned about the speed with which these vaccines are being created, Dr. Carrasquillo.
Yeah. And again, I think, I myself, when I looked at this in April, no way, how can this be, done so quickly? And having run one of the vaccine trials, I could tell you, it was an extremely interesting experience doing this. Normally, we take about a year to plan a study and get it all up and study. I take 6 months to train my staff on how to do things. This was really done at warp speed. I mean, we got the protocols. We had to train everybody in a week. It was very stressful, extremely hard. We were able to rise to the challenge, but we had a lot of issues. We talk about Latinos, the Spanish translations for all the materials didn't come out till a couple of weeks later. Normally I would never start a study without having the stuff in Spanish. Normally we enroll people to a study, it's 1 or 2 people a day. Here we were enrolling 20 people a day for several weeks, for example. But I think the big thing that this was very different was normally when the studies are completed, they're analyzed, the data is done, people look at it, relook at it, and then the companies start making the products. And that takes a long time here because there was a guaranteed purchaser. The company started making the products even before the data got in. So, there were some stuff that was done. We didn't know until 2 weeks before the study, based on the phase 2 data, 1 dose or 2 doses for Janssen. Turns out it's 1 dose. But this was a public health emergency. We had to really rethink, clamp down, and really work harder than we've ever worked to get this stuff done because it was a public health emergency. As an investigator, I could tell you every side effect we track, we record everything. Every time somebody calls us, we document that. So we're keeping very, very close tabs on all this data. These people get lots of follow-up with blood tests, with surveys, electronic questions. It's a tremendous amount of follow-up to assure everybody that the vaccines are safe and effective. So while I did have concerns about how quickly participating in the studies, while it was a little bit nerve-wracking and really pushed us to the limit, it was done the way we would normally conduct typical research. It was just a little bit of a warp speed, but we had no choice. I mean, as far as kids, again, I'll wait. I can't make it. I don't think kids are going to be part of the first recommendation groups. We'll wait for those guidelines, but we know our vaccine, and I know the Moderna vaccine wasn't tested on kids yet. So we'll wait the actual guidelines and guidance. But yeah, we've done the best job we can to assure people that the vaccine is safe and effective. That's all I can
Dr.
say.
Carrasquillo, so they want to know if someone who gets the vaccine can still be a transmitter of the disease, can still still infect people once the person who's gotten the vaccine.
Yeah, so we learn a lot from the flu vaccine. It's 50 to 70% effective. It doesn't prevent you, 100%, right, from getting the flu. And that's what we thought about these. The preliminary data over the short term is very promising. So it's still not 100%. So there is a small risk. But if you vaccinate enough people, we get to what people had called before herd immunity, but this time through vaccinations. And just like the flu vaccine, if you vaccinate everybody, you dramatically reduce the risk of transmission. And that's what we're trying to do here. And that's why it's critically important, because it is not 100% that everyone gets vaccinated.
Right. And how do you know who gets vaccinated? And this question for everyone, and I know everyone is so worn out with wearing masks. When can we stop wearing masks?
I'll take a shot at that. When we do a good job at vaccinating most people. It's one of these, we do need to get a certain amount of the population, vaccinated before we can say, okay, the all clear now. So that's why our initial focus now is on vaccinating. If 100% of the population who had vaccinated by the end of the summer, and we knew that the vaccine was 90% effective, then that'd be great, and we could do it then. But we have to wait and see. I can assure you that if the vaccine uptake is as good as we expect, by next holidays, we'll be in a very, very different situation in terms of social isolation and social distancing. But it depends on everyone being getting the vaccine.
Yeah, and everyone is worn out in the community. Dr. Bejar Sussman and Dr. De La Rosa, you know, the mask wearing message you're still putting out there strongly. How have you been coping with people that are just burned out on all of this?
Well, I mean, I could tell you for Thanksgiving, so many people really faced the really difficult decision of do we do our usual thing, or do we really listen? And my advice to everybody was, look, you know, if you can keep it small and really follow the guidelines, then, you know, for hopefully next year we'll all be together and we'll have the big, you know, I used this year to try out recipes just on my husband. And next year I'll be able to have the big bash. And I think that's what really we have to keep our eye on. The fact that we have this vaccine, really, we're right at the doorstep of having it. And all we have to do is hang on a little bit longer. And I think that makes it so much easier to deal with the fatigue. If we know we're almost in the home stretch here.
Yeah, and to add
Questions
to
are coming. Go ahead.
what
Go ahead,
Dr.
Dr. De La
Bejar
Rosa.
said, just briefly, that I think we need to turn to community leaders to get the message out, to continue to get the message out. Particularly, you know, in our communities, you know, there are, you know, people that are deeply religious, okay, are faith healers, you know, to let their congregations know that, you know, it's important to wear masks, it's important to follow all the rules, as well as where people go to, you know, that like small businesses in the previous question that you asked. So people continue to, you know, we need to continuously give that message out. It has got to be out there, but it's got to be done by people that people trust in those communities.
People are starting to ask, because we just finished Thanksgiving, and should they travel for Christmas? I mean, I would guess the message is the same. Not everyone this vaccine is not going to be available to enough of the population to say things would ever get back to normal before Christmas.
And it takes several weeks. Again, some of the misinformation at the other side, I've heard you get vaccinated and tomorrow you could go to that big party. And the answer is no. It takes several weeks to develop appropriate antibody levels, and we need to get to a certain level of vaccination. It's really hard. Again, like Dr. Bejar Sussman, I told my mom, who's in New York and she's 79 years old, look, we can't get together this Thanksgiving, and Christmas is going to be the same. Unfortunately, for many of us, that's just how 2020 went, but we're hoping 2021 is going to be a totally different year. But we need to hang on for a few more months. You know, that's pretty clear.
Yeah, we knew this question was going to come up, and everybody can help address it, because everybody's like, how do they get a vaccine? Once a vaccine is approved, how does one get a vaccine?
And, you know, those are the kind of details that are still forthcoming. I wish I had an answer. All my patients are calling me up, sending me emails. Hey, I want to get on the list. I want to do this. You know, we do know that the first doses are not going to be for the general population, and those distribution plans are being worked on. And, you know, we look forward in seeing how those plans are. I could give you an example from how we're doing it internally at the University of Miami. We sent out for the frontline healthcare workers and see how many are willing to get the vaccine, and then they'll prioritize who are the most critical that need to get it. You know, I'm hoping, I work in the hospital maybe a couple of weeks out of the year. I'm hoping that the nurse that's in the intensive care unit 24/7 every day gets it ahead of me. That is, you know, the way I want to see it prioritized. You know, the people that need it most critically should get it. Certainly the highest risk, the people in nursing homes that are institutionalized, those are the ones. And eventually it'll get out to the general population, and we'll see how those distribution plans are, but we don't have that answer just yet.
Yeah, it's, you know, everyone wants to know, you know, everyone wants to know, how do I get it? They said there were also, someone said in that they were immune compromised and they're not being recommended to get the vaccine. Is that true? I mean, we have a lot of information out there. I want all of you to address, like, how are you pointing people? Where are you pointing people to get their information?
So we'll have all those details, about emergency use authorization, who will get it, we'll look at it. And, once, it's approved by the FDA, who can get it under EAU. It will not be mandatory, which is really important. Those are the kind of details everyone wants answers today. And I'm just begging a little bit of patience. We will know those details at some point, but they're not coming up now. I could certainly tell you that in our studies for the Janssen vaccine, patients, let's say with HIV, certainly could be included as long as they're well-controlled HIV. If you were not taking the medications and you had very poorly controlled HIV, we weren't going to put you in the study. But most patients with HIV that are well-controlled, they could certainly be part of the study. So we are testing it in that population as one example.
Yeah. What are some of the new treatments being used to treat patients with COVID right now?
The medical questions. So I guess I'll take a first stab. The most exciting treatment now, they call it the Trump cocktail, but it's the monoclonal antibodies. We started doing it about 2 weeks ago here at UHealth, and that's the one. There's a couple of companies, Lilly has one, which is one we're using. Regeneron is another one, but that's one of the most exciting. But we're still doing research. We're still testing convalescent plasma. There's a lot of other treatments and interventions that we're still doing research on. That's still important to do. But yeah, the one, I call it, in the summer, in early summer, everyone was dying to get hydroxychloroquine. And so for a few weeks, there was a shortage for people that, needed it for other conditions. So we go through these cycles. The monoclonal antibodies are the one that everyone's knocking down the door for. But again, we'll see what the data shows. It's under emergency use approval only right now, but we keep testing.
Yeah.
These things.
All right, we'll give Dr. Carrasquillo a break. Dr. Bejar-Zussman and Dr. De La Rosa. Yeah, I'm glad he brought up other conditions because you also have to get out the message to how to get people to go in for treatment, for screenings, for other conditions, which in the beginning of this pandemic, we were all told to stay home.
Yeah, and people should definitely continue to get their health care. There's different ways of doing it. They should check with their providers. A lot of them are doing telehealth when it's something that can be done without a physical screening. Your usual, your screenings, you should follow up with your providers and find out if they're open. I think that most of them are. I know at UHealth, many are open. And it's really important not to put off your regular health care. If you have any kind of a chronic condition, your regular checkup, it's really, and also for your mental health, to not decide, to put it off because of social distancing. There are ways to safely get care.
So important. Dr. De La Rosa?
Well, yes, I totally agree with what Dr. Bejar said. I think that, and from what I understand, most doctor practices that are seeing clients, that they're very well prepared to deal with them. From what I know, my experience, that they take all social precautions. So the probability so you get in the virus is relatively low or almost non-existent. So I think you need to let people know that it's very safe if you need to go in, okay? To see your physician because of any procedure you need to have done or exam you need to have done that requires you to see your physician face to face. That is relatively safe, and then you should go. You should not put it off because then you can have other health problems that could really cause you problems. So I think that it's important that you follow through, and those messages need to get through. I mean, and I think, as Dr. Carrasquillo said, that the relationship between patient and physician is very important. And I think there's a strong level of trust between the physician patient relationship. I'm sure that the physician will let them know that it's safe for them to come in. So
yeah, that's excellent. Here at UHealth, I mean, people understand anyone before a procedure gets tested. So we only bring people. We screen all patients. Right now in primary care, we're doing about 70% telehealth. But the 30% that need to come in, we're seeing them. People don't wait in the waiting room. We have them in the cars. Everyone is screened for temperature before they go upstairs. We also, when they come upstairs, we put them immediately into the room. Once we finish with a patient, the nurse comes in and she cleans everything. And obviously we have to wear face masks, a mask, the face shield and gloves that we change in between every patient. So there's many steps we're doing to ensure, like every health system is doing right now, to ensure that we adequately protect those patients that need to come in and have to be seen. So yeah,
Yeah.
people should not be skipping out on healthcare during this very important time.
Yeah, and you guys are so important that you work so closely together, because the message you're sending, the Dr. Bejar-Zussman and Dr. De La Rosa, then implemented in the community. And it's so important because businesses have played such an amazing role. We're all trying to deal with this together. Dr. Carrasquillo, herd immunity, what's a realistic view, a realistic goal of when we will have this herd immunity? And
Again, we have estimates up. Again, we don't know yet because we don't know what the vaccine, how effective vaccine. We have short-term data from the 2 mRNA vaccines that the FDA is reviewing. We need to see that. We need to see what the long-term efficacy data is. Everyone throws around 70% as a number. I don't know how close that is to reality or not. I think the message for everyone is we really need everyone to get vaccinated. I mean, that's the real message. I don't want to throw out any numbers like that. I think we want, most people to be vaccinated in this country. That's what I want to see as a doctor.
we have a question in the chat. What is the chances of getting COVID, Dr. Carrasquillo, if you're wearing a mask?
Nothing's 100%. That's what I'm going to say, right?
Mhm.
You can easily, be wearing a mask and then somebody who's not wearing a mask comes to your home or something like that. Or, there's different ways to contaminate everybody. A mask, we do know a mask dramatically reduces chances of you spreading it and also reduces your chances of getting it. But nothing's 100%. Everything else works. It's not just about the mask. It's about the social distancing. It's about the frequent hand washing, and all those things add up together, and all the common sense precautions. If you wear a party and you go to if you wear a mask and you go to big party at a big indoor party and where half the people wearing masks, I can tell you your chance of getting it is much higher than if you stayed at home and didn't go to that party. So, we have to do all the common sense precautions we know work. And that's still critically important.
So important. Dr. Bejar-Zussman and Dr. Mara De La Rosa, any thing you would like to add that you think is so important as we get out all this information during this panel?
I would say to everybody on this call, look for trusted sources of information. As was mentioned, your health providers, the Centers for Disease Control and Prevention, the CDC website has all kinds of materials that you can go and access for your own information, that you can print up and have at your business, put it on your doors so people see this, really good information, and spread the word, spread the factual word is what I would say to everybody. And we're here for that, and we're happy to guide anyone in distributing any information that you would like in English and Spanish. It's available in lots of languages, and please reach out and we'll connect you.
Yeah, I will echo Dr. Bejar-Zussman advice. I think in addition to that, I think we need to make every effort to deal with all this misinformation that's out there that's really might prevent people from getting vaccinated. All of us need to really make an effort. We're all together on this. We'll rise together or sink together. I mean, this is something that we all need to do together. We just got to work very hard and getting the word out and getting people vaccinated and getting people, to follow all the mitigation rules that we know work, and continue to do so. And hopefully, next Christmas, it will be a much different Christmas than the one this year. We'll be able to see our loved ones, we'll be able to travel, we'll be able to do all the things that we were able to do before this pandemic.
And maybe some of us maybe even be better cooks, right? Because we had no choice but to learn how to cook. Dr. Bejar-Zussman, the mental toll of this on children. I see people asking in the chat, their children want to socialize. I know my 13-year-old has had a really hard time, and I have a socially distanced study homework group with another child that's home that I can trust, but it's so hard on them.
Yeah, this has been a really, really tough time on kids because they don't have the long-term view that we can have as adults. So they see the immediate, they're really being kept away from their friends. They're also being kept away from school. In fact, for a lot of children, school is the source of their mental health services, and that's been terribly disrupted. I would say that, first of all, as a parent, have the conversation when you yourself are calm, right? Because if you're stressed out and you're freaked out, and if there's anything that's going to freak out a parent, is the fear of something happening to their children. So you have to be calm. You have to be willing to listen, validate, really understand that they're missing out on something that's really important to them. And remind them that they're not taking care of themselves, and they're taking care of their family, they're taking care of their grandparents, anybody else in their lives. And look things up together with them. Ask them what have they heard. Find out what do they know, what are they afraid of, and even if you don't know the answer, it's okay. We don't know the answers. It's just, ourselves, we're being asked questions that we don't know the answer to. And we can look together with our kids, go online, look up the information. Of course, it depends on the age of your children, right? You have to have a sense of what they're capable of understanding. But kids are, filters are getting for all of this misinformation also. And we don't know what they've heard out there from their friends, from social media, et cetera. So yeah, there's no doubt it's a challenge. Schooling has been a big challenge. There's been probably about double the rates of school failure, double the rates of absenteeism, and those things have a snowball effect. And so I think there's going to be a real need to address sort of the remediation to get our kids caught up, because they are having a tough time this year.
Yeah,
Yes, it certainly has
just
been.
briefly, I have a 13 and 11-year-old. They go to school, so I'm dealing with the double whammy. In some ways, it's good that I have them together. But one of the biggest issues that I face with them, is that they are using a lot of the internet to play video games. So I think we need to develop some activities, outside of that, with the family. So I think some of the things we have done is, sort of develops, a family time where we all get together and, actually they're learning to play some of the old board games like Monopoly together with some of us, and so we kind of get together, and actually, now they're a lot better than I am. I lose all the time. But, it's an opportunity also, this pandemic has also created opportunity for families to come closer together, for you to, to talk to your kids, find out more about them. But at the same time, be aware, that there's certain things that are going to happen because they have more time. They cannot go out. They cannot do certain things. They cannot even play with their neighborhood friends, because there's a possibility somebody might have COVID-19 in that family and so forth. So they're isolated. So there's an opportunity to do many things, but you also have to be aware of some of the issues that come across, not just school related, but after school related. And I think internet addiction, is one of them that I think we haven't talked about. In the use of gaming by kids, and the use of social media is something we need to be aware of. So there are many things we can do. There are many negative things.
I am so glad you brought that up. I just kicked my daughter off of TikTok, and I am her primary playmate. I rethinking having an only child, but unfortunately, it's too late for me. It is very that creates a lot of social issues, anxiety, also misinformation. We're getting so many questions, Dr. Carrasquillo, about information. The World Health Organization, Cliff wants to know where else is a trusted source of information. And also, this is also a question for you, so I'll ask it. Does Johnson and Jensen use a live vaccine?
So first of all, as Mario, first of all, the World Health Organization is an absolute credible source of information. Absolutely. It's a real shame how it's politicized, and depending on what political party you believe in the science of the WHO, which is certainly top notch, I would certainly do that. The CDC is beginning to speak out more and be much more credible again now with the change in politics. They're also, we can go, but as Mario said, many of us listen to our trusted community leaders and trusted groups, and that probably for many of us, many of the listeners is going to be the kind of people we turn to, and that's also fine. Listening to the academics, listening to the universities, but really believing in science, that above all. And I forgot the second part of the question.
Does Johnson & Johnson use a live vaccine?
Yes, I've heard that. I mean, people think the flu vaccine is a live vaccine. It's not. And there was one for kids that you through the nose. It's no longer. But the COVID, absolutely not. We use messenger RNA. The Janssen is a piece that, it's a protein subunit, which is on the coating, which is the most immunized. There's no live virus in these vaccines. But have I heard that on the internet? Absolutely, that this is the government's way of actually injecting you with virus because they want to commit genocide. Absolutely, it's been out there. And, but again, it's one of these things that's totally removed from the truth. But, it's really hard to convince people. These are deliberate attempts at misinformation. I don't know why people thrive on spreading things that are absolutely false out there, but some people are. So I don't know where the craziness comes from, but it's absolutely not true.
Yeah. And to our community warriors, Dr. Bejar-Zussman and Dr. De La Rosa, are we telling people to get the flu vaccine? I know I had my daughter vaccinated for the flu. So important during this time.
Absolutely, absolutely. People should, just like the people should continue to get their health care, people should get the flu vaccine. If you get both the flu and COVID together, the two things, you're going to have a much more severe process of the disease in both cases. And so please, by all means, get vaccinated. I know I got mine.
Yeah. And also there's a question, go ahead, Dr. De La Rosa.
No, I agree with everything Dr. Bejar-Zussman said.
Yeah, no, you guys are doing such amazing work in the community by getting out all this information. Dr. Carrasquillo, if 1 million Floridians have been diagnosed with COVID-19, they want to know, do they all have antibodies? And if one is confirmed to have the antibodies, do they need a vaccine?
So we don't know how long the antibodies to the disease are protective. We think it's protective for several months at least, but we really don't know. So right now, in the Janssen study, we included everybody. We do know who got the antibodies or not, so then we could do analyses later on, but everybody's been, the guidelines we got from the University of Miami for employees, we're not gonna be doing antibody testing on, everyone who wants it should get it, and we're certainly encouraging, regardless of your antibody status. I heard some people argue that we should ration the vaccine, and those that are antibody positive shouldn't get it. I've not seen any plans about that, but that's one of those myths that's out there as well.
All right, thank you to all our panelists, Dr. Victoria Bejar-Zussman, Dr. Mario De La Rosa, and of course, Dr. Olvin Carrasquillo. It has been a lively discussion, and thank you for all you continue to do as this situation continues to develop. Thank you to our sponsors. I appreciate being here today, and thank you for having me. I'm gonna toss it over to Brian Brown. He's an executive with AvMed, the head of group sales and retention. It has been your pleasure to be your host, Mr. Brown.
Great, thank you very much. And first off, let me again thank you, Nikki, for running us through.
You froze, Brian, sorry.
Yeah. Listen, we did well. We made it through our only freeze. It's 227, it's our only freeze. We're batting 1,000.
Agreed.
Brian, did we get you back? No, I don't think we'll wrap it up from here, but so many of you out there, we know there's 200 plus people on this call. Hi, Brian, are you back?
Oh,
all right,
I am.
take it away. We hear you. Yes.
Thank you. Sorry, well, one of the most popular phrases in 2020 is, am I off mute now? And my system froze, so forgive me for that. But I did want to say thank you, Nikki, for running us through this wonderful discussion. Dr. Bejar-Zussman, Dr. Carrasquillo, and Dr. De La Rosa.
Again.
Well, I guess,
Yeah,
Nikki,
we
you
seem
can wrap
like
it
we're-
up then. Yeah, thank you.
All right, guys. Well, thank you for the lively discussion and thank you for the great information. And I know that the organizer of this event will make sure everyone gets the information and the slides with all the information they need. Thank you for all you're doing, everyone. Happy holidays. Continue to stay safe.
Thank you.
Thank you. Bye-bye.